start drinking. I started.
Shall I call the meeting?
Go for it.
Call the meeting to order. We begin with the pledge of allegiance. This is joint meeting of the county council and the commissioners. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The purpose of this meeting is to discuss the EMS funding shortage for 2024. As you know, the county has a contract with the county and the hospital to provide EMS services. I don't know where you want to start with it. Okay, we got a request for additional appropriation in the amount of $120,000 to $39.25. I think that carries us through what? September?
August and September.
August and September, that is. I think we had budgeted, what, 275 or something like that, which we've already spent that, plus we spent a little additional that we had for our equipment. I think another 27,000 or something, was it 31? So,
Okay, I'll start. I've got a few questions. Part of it is, and I looked at these and I got the numbers and I got some answers. But we've got a high of 229 runs and a low of 171. And I asked a question about having 2 runs because primarily we take it to the hospital and then we'll transfer to another facility in most cases. So I'm assuming we're being paid twice, correct? We both know. Under you, whoever.
I'll go for it.
I think there's inappropriate in most
So
cases.
when we transport a patient, we send the insurance or the patient a bill regardless of where the destination is. So if we pick them up at home, take them to the hospital, we're billing somebody, whether it's insurance or patient. And then in turn, if we take the patient from the hospital to another facility or back home, we do some returns to nursing homes. That is a second run, also billed for, that we do receive revenue. So we could have one patient with 2 bills on the same day, perhaps, depends on the situation.
But generally, I'm just trying to get a feel for the numbers and that, and what we're doing here. It's just like, and one of the things, and I believe you've answered this, in January, we had gross revenue of 299,000 and change, and contractual adjustments of 304,000. So in essence, our gross billing was completely offset by our contractual adjustments. But I think we determined that they're not month-to-month correlated. Those may be an adjustment that came from November that finally hit the books in January.
I'm going to defer this one to Megan. She's the.
Okay.
I'm
just
explain that.
Just trying to get an idea because it looked like you lost money even on the gross amount.
Do you want me to explain? Some of that is follow-over from the previous month. It's when, most of it is when our insurance processes. So it could be December claims paying in January. And with the new billing company, our gross revenue wasn't as high and we're still having old claims processed with our old billing company.
So that's why it throws that off when we get a number. I mean, it basically shows here we lost $28.67 before we had any operating expenses in January. But that's relevant probably to the contractual adjustments that we had. I went through the whole thing, and I think Leonard made mention of insurance and not collecting either full payment or all payment, or some were billed late, or can somebody shed some light on how that occurred?
I'm not following you.
Okay, I think at our commissioners meeting, you came in and said some of this we were hit. Maybe it's,
Okay.
maybe it was September because we had a $340,000 contractual adjustment there.
I
But
think
it's because you didn't get the either you didn't get the bill in, the billing company didn't get it in, or something happened and we never received the revenue.
The part of the contractual adjustments, I believe, the billing company projects what we should expect to get paid from that claim. And if they were, instead of writing it off each month, they just wrote it all off at one time in August, I believe. Is that correct?
Got the bad debt in there.
Yeah. Instead of a little bit each month, when I say bad debt or the contractual adjustment, we send a bill for $1,000. Insurance says, we're gonna give you $300, just because they can, but nothing we can do about it. So that's the bad debt and the contractual adjustments there is that $700 difference. We have to account for that in our finance report somewhere as to why there's a shortfall. And it's usually the contractual adjustment line, I believe, is that correct?
Yeah, Randy, I think what you're referring to are the claims that were written off due to past time to file. So you have a certain time frame to file claims in healthcare. If you don't file claims in that window, then the insurance companies don't pay you.
And what kind
And
of,
that window
and they
depends
probably
on
have variable
insurance
times,
companies.
depending
Right,
on the insurance provider. I'm
exactly.
assuming.
So what we did, went back to the AR company and asked them, how many claims have we written out due to past time to file? And there were only 20 claims, of which we do about 2,100 claims a year, so it's less than 1%.
So 20 claims basically, and that we use our average was probably then $300 or $400 a run. Is that what we're thinking?
Yeah, it's not.
So,
And it's pretty common when you switch AR vendors that there are learning processes and developments in healthcare. It happens in every revenue stream, in every AR company. When you switch them over to a new company, they've got to learn how to get the bills from the hospital or the system. We've got to learn how to get the bills to them. So sometimes there's some issues. Sometimes the payer and credentialing, the EMS service with insurance companies doesn't go through, and they delay. So it's just pretty common to have those. In my experience, and Randy can speak to this, 20, less than 1% is really low for us to write off the past.
and do we know what the cause was? Was it something internally here?
No, I asked them to pull those 20 claims and find out for us exactly, but it's probably going to be different for every claim and every insurance company.
Just thinking, so we address that issue if there's something that's falling through the
Yeah.
cracks.
So they're pulling that for us now so that we know if it's something on our end, we fixed. So my guess is it's probably something with insurance companies, just the entire credentialing process.
And the company, is it the same company that Deaconess uses?
Yeah, so the reason this new company is because the old company in 2022, we collected 16 cents for every dollar we billed. At the time, Deaconess EMS was using QuickMed Claims, who we use now, and they were getting 20 cents on the dollar. So that's why we made the decision to switch so we can get more money than we billed for it. To Randy's point earlier, we might bill $1 million, but we're only going to get 200,000. So we want to make sure we get 10% that we bill. We went back and looked and had the vendor pull what we're collecting now. We're now collecting 26 cents on it. So we're actually 10 cents more for every dollar we bill than we were 2 years ago.
Okay, could you walk me through the policy, and I'm supposing you have one, from the time of completion of the ambulance run, all the way through the time frame of when it is reported to the billing company?
So after we complete a run, whether it be dropping off at our hospital or another hospital, the state requires us to have our charts complete within 24 hours. And here at Perry County, we require it to be done by the time you go home at the end of your shift. So a lot of times it's usually done well within that 24-hour time frame. Once that chart's complete, it goes into the cloud. And at 5 a.m. every morning, all those charts that are complete get submitted to QuickMed Claims for coding and submit whatever that all entails. All the billing stuff. They go through it. They determine whether it's a ALS, BLS, level 1, level 2, specialty care. If maybe we can't bill for it because we didn't meet medical necessity if it was a transfer, or maybe we didn't have the right documentation to prove that it was medically necessary. They go through it. They determine what the charge is and how many miles they can charge for, and then they send that off to the appropriate payer.
Okay, and how's the entire process that you just spoke of? How is it tracked and the dates confirmed as to the ambulance run, charting complete, and submission to billing and date received, as well as billing completed?
How do we make sure that our charts are getting done?
Yep, how's it confirmed for the ambulance runs, the charting complete, submission to billing, and the date
As far as
received?
getting our charts complete, we have a QA process, quality assurance process that we run. I can run at any time. I usually check it about once a week, every other week at the least, to make sure that our charts are getting done and that all charts are accounted for, or all runs are accounted for by having a chart submitted.
Mhm.
And as far as I can see on my export list on our charting system, what charts have been exported to the billing company, which ones haven't. Very seldom is there any that don't get exported. The last one, I think that there was one of a batch, one single chart out of a batch of them that went out that was missing some little bit of information that was easy fixed, and it resubmitted at 5 a.m. the next day. Excuse me,
Who's responsible for the tracking of this and for the records and stuff?
myself.
You know,
That's the expectation of all the directors of the hospital departments, is that they review the revenue charges and reports from the day before to make sure that we're billing things appropriately and make sure that we're not missing charges.
okay, so this is done daily? Or
It should be. It's-
And that's how the insurance company gets the info?
The insurance company has sent the bill from our billing company, QuickMed Claims. QuickMed processes our chart, and then they send the bill to the appropriate insurance
Mhm.
or payer. Sometimes it's self-pay, depends on whether they have coverage or not. If the payer or the patient does not have coverage, they send the bill directly to the patient.
And the cost of outsourcing versus keeping collection money in Perry County as an employee of a person, is that how does that?
As far as using QuickMeds for our billing purposes,
Because I know they get a slice of the pie.
they get 5.5%, I believe, correct, on what they collect. So if, like Jared was saying, if they collect $200,000 out of $1 million that's billed, we pay 5.5% to QuickMeds for that $200,000 that they collect on. So they only get paid for what is collected, not what is actually billed.
How long have they been doing this?
QuickMeds,
No, I mean, outsourcing the billing.
QuickMeds took over January 1st of this year. Before then, we used a company called Great Lakes Billing, and I believe they started in 2021. I don't know the exact date off the top of my head, but it's the year of 2021. So we've been using it a third party now for about 4 years, 3 to 4 years. Before we used a third party, it was all done in-house
Mhm.
by the billing office. That also handles all the other departments as well as they were doing EMS. So it kind of took a strain off of them. So they had time to focus on the other aspects of the billing for the other departments. QuickMeds and even Great Lakes, they only do ambulance billing. That's their specialty. They don't do the other departments. They are able to keep up a little bit better as far as changes in Medicare and Medicaid requirements and billing practices, making sure we have what we need to get the best reimbursement that we possibly can.
EMS is one of 2 service lines in my career, 20 years, that you do not want to do in-house. It's just niche. It's hard to bill EMS. It's the same thing with anesthesia. You don't find hospitals billing that in terms of anymore. You hire outside companies. It's like Regis is doing it because they have expertise.
So did you receive a greater return by outsourcing it?
Yeah, we have, with QuickMed claims, we now collect $583 per claim, where before we were collecting $460.
So it just makes,
The Medicaid part, the reimbursement for this, is that just like tied to the consumer price index, the rate increase that they pay per year? And then done per year?
As far as what they pay for us,
Yes.
to us.
Yeah.
How they determine their rates, I'm not sure. But since the hospital has a contract with them, we basically have to
What is that?
accept what they offer us.
And wasn't it last year that was it Medicare that went up?
Medicaid.
Medicaid, sorry, I get mixed up. Medicaid went up, was it $7
I can't remember.
a mile?
Like, I know it went up because Indiana was historically low compared to every other.
I thought it was around July it went up. I thought we were talking about it was gonna go up around 7, and I even thought there was another bump. Was there 2 last year? No, just 1?
I expect it's just one.
Okay. Because that was supposed to be, I thought, what was gonna help raise the wages and those type of things, so that,
Things we put in place to help. improve
That's
our
right.
bottom line.
Yeah. and then it would cut out some of that overtime, that critical pay, that type of stuff. You can get your staff's pay up the city. So how's that going?
As far as,
Your
Staffing?
staffing, yeah. What's it look like? Is it better than last year?
I'll tell you this, which I talked to HR today. When I took over in May of 2023 as CEO, the prior 12 months, we had 0 paramedics applying. Since then, we've hired 6 paramedics and 8 EMTs. So
6 paramedics and 8 EMTs, that's great.
So what's your average ambulances you have per day or in a shift? 2?
we have 2 trucks a day, 1 here in town, 1 out the North Station. 2 out of the 3 days, we have 1 ALS and 1 ALS truck and 1 BLS truck. 1 of the 3 days, we have 2 ALS trucks. Our shifts rotate on, we have 3 different shifts per se. Shift 1, 2, and 3. One shift is 2 medics, so 2 ALS trucks. The other shift is just 1 and 1 BLS truck. Usually the BLS truck is up north because of the higher call volumes here in town.
And that's due to personnel, it's not.
We don't have enough paramedics to staff
Exactly.
2 on every shift.
Yeah.
Right now, we have, counting myself, we have 5 full-time paramedics.
These, if we had another ambulance, a third ambulance, these numbers would be even worse because you won't have additional calls.
Correct.
And you gotta find the personnel.
With the third truck, we're usually staffing it with 2 EMTs. We haven't had a third truck in a while, but when we did, it was usually 2 EMTs. Of course, payroll for them, sometimes it's 12 hours, sometimes it's 24 hours. A lot of times, it wasn't always PRN staff, there was some overtime in there. So we tried to kind of do away with that per se, to avoid that extra overtime to help out with the wage costs.
So do you have and I'm not looking at a specific number, but how much it costs per ambulance to have it staffed and operational? And there's X number of dollars, so if we wanted 2, we take it times that. If we wanted 3, we take it times. The reason I ask this is like you're now asking for 120,000, which will just take you through 3 quarters of the year through September. They will have October, November, December yet.
Correct.
It'll be shortfalls, and I think was it 285 that we've paid so far.
Correct.
So another 120 added to that, we'd be at 410,000 or 15,000.
And October was $26,000 we would be asking for, whenever that
26 comes.
26.
But we still, even if we had 326, we'd be looking at $500,000 in subsidies for running 2 trucks.
Correct. At the first part of the year, we were running 3 trucks up until, I think, in March, maybe into April a little bit. Not every day, but probably more often than not. But since we cut it back to having just the 2 trucks, the cost has obviously gone down. As far as the cost of actually having that ambulance staffed and ready to go, I can't tell you that off the top of my head. I could punch some numbers, and I would have to ask Megan for help with that. She's a wizard at Excel, so she does.
Leonard, do you have any idea what our neighboring counties' budgets are for their EMS? Spencer County, Crawford County?
I do not.
I pulled Spencer County's EMS, Form 990 is publicly available. Their gross receipts were 1.5 million in 2022. Their expenses were $500,000. But that's gross receipts. So if you apply a net revenue collection percentage of 28%, which is what we do at our EMS, they're operating at $1 million a year loss. That's just based on 990.
I know when when I worked EMS, when John was there, and we were talking about 10 years ago or more. And Warwick County was, and of course, I understand Warwick County's bigger, but their budget, we're talking about 10 years ago, they were in excess of $2 million. Am I right, John? You don't remember? And I think Spencer County, 10 years ago, their budget was over $1 million.
I think Leonard's doing a great job managing operations of EMS. I think where our EMS was last year and this year, $500,000 loss, it's pretty good to have 2 trucks on the road in this day and age for EMS.
I know the loss seems to continue to grow. Like a few years back, it was like, I know in 2020, it was like 275,000, the loss for the year.
But that's changed a lot.
Yes.
You know how many runs Spencer County in a year you looked at?
Did you say you had 3 trucks through March? About
Give or
somewhere?
take, I don't know.
I was just gonna,
The transfers just bringing more.
Not every day,
revenue.
probably one, maybe,
If they're-
probably 4 days a
If
week
they're paying
average,
for snail transfers,
would be my guess.
they'll
without
lose
actually
in
looking at it.
medications,
it's okay.
but you can charge them $20 a month.
Leonard, do you see, in the future, having a paramedic on each one of the trucks? Are you working for that goal? I know it's hard, it's
Our goal
staffing
is
issue.
2 ALS trucks every
Yeah.
day. Once we get staffing for that, we will absolutely have 2 trucks.
State statute says you have to have one paramedic, correct?
To be an ALS provider organization, yes, we have to have 1 ALS.
24/7.
Yeah, 24/7. And we've met that requirement, as far as I know, every day this year at least. Prior years, I think there may be a slip here and there for a few hours or something, but I can't speak to that for sure. But yeah, the goal is 2 ALS trucks every day.
So Leonard, do you do most of your transfers? Or you set them out?
Me personally,
No, not you.
I try to do as little as possible.
Now, internally
Yeah.
within the county's operation, are
As
you
far as-
get third parties to come in and do the transfers?
Out of our hospital.
Yes.
Most of the time, we're doing them. It depends on the severity of the case and what we have available. There were times in late 2023 that we only had 1 ALS truck. We didn't have even a second BLS truck, just due to staffing and shortages. So at those times, yes, the hospital was using a third-party provider, whether, I think Pike County has a convalescent transport service that would come a lot, air evac, helicopters.
Leonard, if the Perry County EMS didn't never make another transfer out of Perry County Memorial, what would the deficit go to? Would it go up or down?
Our run volume is like, I think we looked the other day, is like 40% transfers, is that right? 40% transfers, 60% 911s. We're collecting a lot of our revenue from the transfers because
You just don't
usually
use that.
medical necessity and insurance are going to pay that most of the time. Very little are they denying it because it wasn't needed. As long as we can, we have to complete our chart and make sure all of our paperwork is needed, of course, but.
A lot of revenue comes from transfers. As much as it's bad to have a truck out of the county, it's still good income.
Correct.
Yeah, and it's always been that way, because when we looked at it 10 years ago, we felt fortunate to have the transfers at that time. It helped subsidize the ambulance. And it looks like it's doing it today.
Randy, weren't you guys looking for like 3 ambulances running though? At that time?
Well, we got
Two
to,
down here, one would transfer and the other would be available?
yes, actually, we got to a point several years ago, we had 2, then during the day, we had another truck during the day. And that was supposed to be helpful.
We had a 12-hour truck, I think
Yeah.
it was 9 to 9.
Mhm.
And that would have been like 2017, maybe 18
Yeah.
timeframe.
And that was we thought maybe would relieve some of the, they would take the transfer runs and still have 2 trucks available, one to north and one to south, so,
Try to eliminate that fatigue
yes.
for the working.
But the budget kind of At one time, it was pretty expensive to do that, so
Yeah, I
it still
think
would be
personnel
today
would be
yet
your
too.
biggest expense today.
Yeah.
Finding,
It never fails. The days we do have a third truck on, we get like 2 calls the entire day. But the days we have 1 truck on, eat breakfast at 2 o'clock in the afternoon,
And
much less get supper or lunch. So
if I
it's so
remember,
hit or miss, it's hard to plan for that.
yeah, if I remember right, I think it was an issue, because when you get employees, they'd like to work a 24-hour shift versus just a 12-hour shift, right?
It's not but there was several employees that come from like Newburgh, Evansville area that would drive here and to drive back and forth for 12-hour shifts, fuel mileage and their time on the road added up where they would prefer to be here for 24 hours where.
I think another thing that happened was a lot of your full-time employees was working them 12-hour shifts. So their time and a half just killed. I mean, that just ran that budget through the roof.
So have you ever had, I'm looking at the numbers and I'm an expert in these things. I know we have some type of relationship with Deaconess. Has that service ever taken a look at what we're doing? Say we're doing a great job, or we can have areas that we can improve in or in?
I reach out to their coordinator down there, their director occasionally to bounce some ideas or inquire about how they do some things. Her name's Angie. But as far as that they come in here to see how we're doing or what we're doing, I don't know, maybe Jared just talked to them.
I do the same thing. I reach out to her all the time.
I'm just curious if there's a way, to purchase drugs or to buy things or do anything, and I don't know. I'm just thinking another set of eyes, somebody that's been in the business for an extent.
No, our main driver and expenses is salaries. And that's the hard part for us, is where we get those paperwork, like training expenses and salaries.
All the drugs come through the hospital. The ambulance service isn't purchasing drugs from an outside source, are they?
Correct. Farm Kelly and Pharmacy Kelly and Carrie and Julie are the pharmacy people that I call anytime I have problems. But they take care of ordering all the drugs and medications we use. They supply us. We get them at hospital cost. Of course, they're ordering in bulk, so they get a pretty good deal on them. Usually, most meds that we use are anywhere from $1 or $2 per dose. So there's some that are a lot more, some that are a little bit less, but generally it's $1 or $2 each per dose. And with some meds we have multiple doses of. Right now we're carrying 47 medications on the truck every day on all 5 trucks. That way it's ready to go anytime. And I can't say I've added up the entire cost of all those drugs on the truck because I haven't. But to give you a ballpark, I would guess each truck probably has $250 to $300 worth of meds or drugs on it. And of course, everything has a shelf life, so once it expires, we can't use it. We send it back to pharmacy, and sometimes there are some meds they can get a little bit of credit for when they purchase the next drug. Sometimes they end up disregarding them, and then we just get a fresh batch to replace what we expired.
Our drug expense is about $5,000 a year, so it's not material.
As far as our supplies, a lot of our supplies comes from the hospital, so they're buying in bulk for a lot of the things that the other departments are using. So we're getting a pretty good deal on that. Some of the things that are EMS specific that we order from outside sources that the hospital doesn't have, the hospital has an account set up, if you will. So they're getting a better deal than we could just Joe Blow call off the street and call and get something. So being a hospital, they still have that incentive to have a better pricing than you or I would.
Jared, you made a comment a few minutes ago about the majority of the employees with the most of the money. Would you say 70%?
As far as expenses?
Yes.
It's about 66%, yeah, 70%.
So that's a service.
It's $1 million. Year to date, we've expensed $1 million in salaries. I guess that doesn't include benefits too. So it's $1.3 million in salaries, and the total expense is $1.6 million. So it's probably salaries and benefits.
See, that's very hard to try to trim.
Yeah.
When you're that high percentage-wise on a service.
Keep 2 trucks on the road and be able to bring in paramedics will we have a proven history of not even getting an application, you know, I think you're exactly right.
So Jared, did
Oh,
you use
okay.
some October's numbers to come up with?
Yeah, I just used them.
Because I got basically 915,000 in salaries and 288,000.
Yeah.
But that's not including October.
That's September.
Yeah, that's okay.
This here's, the P and L that Megan usually sends, it is for October. Sorry, it's all wrinkled up. I've been hoping this whole time. If anybody would like to see it, it has the year-to-date figures on it, at least through the end of the month. She said she hadn't sent it yet. I just got it yesterday, I think. They just got it finished.
So you got some more there?
And
This
that's,
is, no.
Oh,
I only
okay.
got
and that's for
one copy. I
October,
apologize.
right?
I'm sorry?
I mean, I've got it for August and September, but that's October.
That's through October, yes.
And our year-to-date loss is gonna put us around 500,000, which I think is what we submitted for last year.
Yep.
Right?
485,
So we're right on line with what we expected to be.
not 500,000.
Randy, you see it?
I remember this.
Randy, you see this?
Did she send it? I don't put it in my spreadsheet.
I haven't finished it.
She hadn't sent it yet.
She said she just got it done yesterday.
So what I've got to net income is 395,000 lost, but that's not October. So the question is, we've only allocated 285,000. I think, as the county is concerned, we need to have the discussion on how many ambulances we want to have on the road. And that's kind of the determining factor, what it costs us for each unit. And then, the bottom line is what it's gonna take to subsidize. Obviously, it's not budgeted sufficiently. If we don't have any place that we can make any kind of investments here, or there's not another income source. I know when it was last year, we met with, you were here, Jared, and they asked for additional 25,000 to give everybody a pay increase. And then once the Medicaid monies came in, they felt like we'd be fine for the rest of the year. And in what were we at, saying 275?
You're 275 in 2024. And
2020.
2023, we did next,
23.
we did
About the same.
we did the extra 25. We're at 215 and
Part of
60.
that was for equipment. I think
We
it
did the
was
full three, we
60,000.
did 300 total, so
300 total.
Yeah,
So we were
because we
at
did-
275 plus the
Yeah.
25.
we did 215,000 out of general, 60,000 out of public safety, and then we did the additional 25, which is we paid 300,000 in 2023.
Did you catch a run, Leonard?
So,
Sorry?
Did you catch a run?
No.
Okay,
thanks, Larry.
thanks, Lisa.
Just kidding.
So we went from essentially, unless you guys get a bunch of money in 23, at 300,000. And now in 24, we're gonna be looking at 500,000.
You did kick some money in 23, didn't you?
Yeah, we wrote off $187,000.
But that was part of not being billed to the county in 22.
Me too, yes.
What happened is you.
Yeah, it was like a rolling time, yeah.
What happened in that instance was, we didn't get billed, and then the county's money all rolls into the general fund and is gone at calendar year December 31. So I think we only paid in 22, I'm gonna guess at this, in the $120,000 to $150,000 range out of the money that was allocated. And then we didn't pay for the last 6
And
months.
that's just out of ambulance services, because there was money in ambulance equipment that wasn't used either in 22 or 23, or
So
24.
that money
We encumbered 2024,
rolled over. and
or 2023 is
gone.
what we paid. Yes,
So I know that was the money, because what ended up happening is you billed us in 23 for 23's 22's shortages, and then we paid those out of the 23 budget. That's why we came up short in 20. But nonetheless, we're going from 300 to 500. That's additional ambulances on the road. Is that the cost?
That's 200,000, isn't it? Yep.
Oh, no.
It's been out there for 8 years. 10 years, right after the
I
hospital.
mean, what's the lowest paying?
So it's almost going on
Still
its
is,
year.
even after the increase.
Oh, I'm sorry.
What percentage is that? Do you have any idea?
I have
know
no
it
idea. They
varies.
pay on a fee schedule, so it depends on the code that's used. And I know on the hospital side, I used to post on the payments and they
There
would
was
pay
one month they made money.
pennies on the dollar.
May.
I was just curious, like percentage wise, is it 30% of your rent, you know? I mean, I know that would vary, but
That's easy to buy, but we just don't have enough time for it.
In my 2
I would
years,
say
almost 2 years,
low. I mean,
they've
right,
only had
less
2
than.
months where they've shown a profit.
Are you asking how many Medicaid?
yeah, like
Percentage.
that percentage of
There's
the
only
other
one
ones,
this
yeah.
year.
Like on average.
So far.
You can get it to, I was just
Medicare,
curious.
Medicaid would probably be.
If Medicaid's the lowest
Three-quarters
paying, I was
of
just
it.
curious. Is there a big chunk of it? There's not a lot you can do about that.
Just depends on.
It's either sign a contract.
Just due to the aging population, we have a lot of Medicare,
Yeah. I understand.
and we still have a
Just
lot of
pay it
Medicaid,
out.
so
I understand.
without looking.
We don't have to
it's
set
pretty high
AMR.
as far as that percentage. that
You don't have to tell me today, I was just curious.
She could probably
'Cause
put
there's
that in
not
her
really
spreadsheet and have it. Time she gets home.
There's not really anything you can do.
It's better than not getting paid at all. Not by much,
There ain't
but
nothing you can do about it.
better than not getting paid.
Hey, Leonard, every now and then there'll be a month where you actually show a profit.
Yeah.
What do you attribute that to?
I think we had one of those this year.
Yeah, in May.
What's the timing when the claims fall and when they get billed, cash comes in?
I think in April, we had a low run volume month. I don't remember what it was off the top of my head, but then
171.
in April it was, what was May's?
May was 221.
I say we had it significantly more in May, so that would probably offset that a little bit as why we was the revenue.
With accounting, you can do an accrual-based method or a cash-based method. When you do the cash-based, what you get cash instead of company returns against the amount. So we get a lot of cash because claims drop. But sometimes payers hold money, and you'll get like $100,000 from one payer that's been holding claims for a while for whatever reason. It'll hit. So,
I do know, if you guys remember earlier in the spring, there was a big security breach with, I forget what company it was, but it was affected a lot of healthcare. What was it? Change Health, which is what Medicare and a lot of the insurance people use to share demographic information for patients, and that was essentially down for a couple of months, I think. I don't remember the exact dates, but it was a while, a significant time frame. So all those payments that would have happened to fall in that time frame could have posted in May due to that outage at that time. Whether that was for sure the reason, I don't know. A possibility.
Leonard, I think they asked you what percentage was Medicaid, Medicare, and how much is private pay.
Off the
I'm
top-
talking about private insurance pay.
Like commercial insurance.
Yes.
Blue
Yeah.
Cross.
It's usually Medicare, Medicaid, or commercial insurance or private pay, which means you're gonna pay for it yourself. Off the top of our heads, we don't know that number, but just guessing, the Medicare, Medicaid is the bulk of that.
Yeah, I know the hospital was, the last time I was out there, I think it was 60-70% was Medicaid, Medicare, and I think the revenue was like a third. That just shows you the proportions. The biggest bulk of the business is there. They're one of the smaller payers. My question is I think January, you're getting an increase from private pay. I think state mandated an increase that Anthem and companies like that must start to pay. But I'm just curious as to how that will impact your budget, depending on the percentages.
I wasn't aware of that. If they're paying more, they're obviously gonna
It
generate
was
more
a
revenue.
substantial increase, but
But
I'm not sure that,
commercial insurance being such a small proportion of our
That's-
patient population, how much effect that's really gonna make, I don't know. And, you know, if it's $1 or $2, we may not even notice it, but you know, if it's a substantial increase, a couple $100 per claim, maybe, we would definitely see it.
I think what we all in this room need to consider is, last year, we did a strategic planning meeting in Deaconess, and the strategic planning director shared the future market growth in Perry County for us. And what she said at the time was in 5 years, so 4 years from now, the 65 and older population is going to increase 20% in Perry County. That's 1,000 more people here that are 65 and older that are going to be living in our county that are in here today. That's in 4 years. So we have to make sure that we do everything. This is kind of my outlook at the hospital. We do everything we can to expand services to take care of that aging population. And same thing with EMS, Medicare. If we go back to one truck on the road, that's 1,000 more people that aren't going to have an extra ambulance here for this aging population. So just something to keep.
I don't want one truck.
No, absolutely not. I don't-
About 3.
Yeah, I'd like to make a comment on that. When I came in Commissioner 12 years ago, we had one truck and we had a call-in crew. John, you might remember that. And I think it was 20 minutes to get that call-in crew to get in and get in the truck and go. At that time, we had a lot of complaints from the citizens of Perry County that, one, took too much time to get an ambulance there, and sometimes we had to get an ambulance from another county because of the transfer runs. And I agree with what Kelly just said. I don't want to go back to those days at all. It's a service that the county, I think, has to pay for it. It's probably me easier saying this than doing it since I'm on the commissioners, not the council. But I think it's a service that we have to provide to the citizens. And it's just like everything else. The prices went up. Back 10 years ago, when we really dug into that, we got numbers from other counties, and I think Spencer County was subsidizing them around $700,000 at that time, if I remember right. It was right under $1 million, depends what year it was. We felt like we was getting a bargain when we went with the 2 trucks. We worked very hard to get the North Station completed. That was promised to the citizens years ago when they built the highway garage, and I don't want to see that leave. It's just a benefit to the county. And we ask people to come to this county to live. We need to provide the service. I know I'm sorry, Councilman, it's easier said than done, but it needs to be funded the most efficient way we can fund it and by working together. And that's what we're doing here tonight, so.
I appreciate that, Randy. I know when I took this role, I met with a bunch of you in different meetings, and that was one of the first things out of everyone's mouth. We've got to get 2 trucks on the road. And I know Leonard and Brandon before him and Kayla, we worked really hard to make sure that we could recruit paramedics. I love that number. We were able to hire 6 paramedics and 8 EMTs last year. It was so difficult for us to get us to 2 trucks. I just, it's a lot of money, you're right, but it's necessary in our aging community.
My opinion, I feel like it's the most important thing as an elected official can do, is provide public safety. Everything else falls down from there, so.
How is your employee retention? I know before you had a hard time getting employed, but the council provided some funds for you to give raises and stuff. How is the retention?
Since I've took over in April as a director, I don't know that anybody's left. I take it back. We've had one paramedic that started in June, but he left to go fly an area back to fly paramedic. So unfortunately, come to work here as a paramedic, you're working as a paramedic. There's not really nowhere to go from there, working here at the hospital. No offense to the hospital, I don't mean that. They're just, unless you want to do management, which not sure that I want to every day, but I'm here doing it. But there's really nothing else. You know, you run calls and you do your chart, you sit around and wait for the next call. There's really nothing else. So I don't fault him for leaving to go fly an area back at all, or any service for that matter. Because I used to fly and I loved it. It got to the point where I was just away from home too much. But that's kind of the next step for him. He was here, worked for a while. His next step was to go fly an area back. As far as retention with paramedics, I feel like we're doing okay. We got the pay raise. There was one in June, was it? pretty substantial one that actually drew in several part-time PRN staff who wanted to come work full-time because of the pay raise. So there was one in particular that was driving to Owensboro to work every day, 12-hour shifts. She now works here full-time because of that pay raise, and the hospital benefits are amazing. There's hands down, I don't know any, I've never worked anywhere else that the benefits are
I
as
was
well.
curious. Yes. You have a line item on here as bad debt. And
I defer
how
to
much is that
Megan.
bad debt that you sent it to a collection agency, correct? How much, is there a line item that when the collection agency actually
Collects the money.
collects the money, some of it, of course, they take part of it, but,
It'll reverse off of that amount. It's not shown in a separate line. So if we send 100,000 to bad debt and they pay, if we collect 1,000, it will reverse off the month that we collect the money.
okay, because the total on this is, year to date is 224. And, that's a lot of money.
Yeah.
And I'd like to see a line item somehow, how we get a return, if they collect on it, and how much of that we get back, so.
And typically bad debt collections are at a much higher rate. Like, you pay quick bank claims 5% and collect their AR. Once it goes to bad debt, they have tried for 6 months or 9 months to collect it. They can't get anywhere. So another company comes in and says, we'll try for
Yeah.
15%. And so they do a little bit more
Yeah.
aggressive, a little more labor intensive to go after.
That number probably falls in the same line as your billing at the hospital also, the bad debt side of it, because it works both ways, so.
We provide a service, we have to provide it for everybody, so we don't discriminate.
So Leonard, they were talking about a call-in crew. Is that an option anymore? Do we have enough paramedics and EMTs that live within our county?
We had discussed it back in,
Where I'm going to is if we have 2 ambulances and we can transfer in order to keep the 2 ambulances active, pull a third one in for transfers, if that's an option.
it is an option, and we discussed it. We put together some, not make-believe, but theoretical policies, how that would work. Right now, we don't have the PRN staff to do that. So anybody that's on call is gonna be a full-time employee that just happens to live in town. We don't want someone living out in Branchville where I live, it's gonna take me 30 minutes to get to town to do a call. We want someone relatively local. We were thinking like 15 to 20 minutes. But, we're gonna have to pay them to be on call. I like to call them sobriety fees. And then they're making time and a half once they come in. So we're not really at an advantage there, other than we have the 2 trucks available. But we have to also take into account how many times are there enough multiple transfers or multiple calls that both trucks would be unavailable. If we call in a third crew to take a transfer and those other 2 trucks just sit there for the hour and a half they're driving only going back, do we really gain anything? So it's kind of got a lot of options away there. We haven't said no, but we haven't said yes, we talked about it.
How many calls are you getting for help me back in my chair? Or
Oh,
things
help
like
by falling and can't get up kind of stuff?
Yes.
A bunch.
Do you charge any kind of a fee for that?
Yes, and no, it's kind of a tricky situation. So what we do whenever we do a chart, anytime we make patient contact, we submit a chart. And in that chart, we either transport it or we didn't. Transport has their fee schedule based on the level of service and the mileage and stuff. A treat, no transport. So we're actually performing something on scene, say like a diabetic call where we're starting an IV, giving maybe some medications, or maybe a minor traffic incident, we're doing some bandaging on someone, but they really don't want us to take them to the hospital. So we're kind of fixing them on scene and letting them go. That is another fee schedule based on a treat, no transport. A lot of our insurance companies don't pay for that, so therefore it gets sent directly to the patient, and that's sometimes they pay, sometimes they don't, usually not. There's also what we call a evaluation only. or lift assist, somebody fell out of their chair, they need help back up. There is a small fee for that, that's billed directly or billed to the insurance. If the insurance doesn't pay, the patient doesn't see the bill. At least that's how it's supposed to work. Is that how it happens all the time? Not always, because there's links in the chain that sometimes get broken between the communication between us and the billers and everybody.
So my next question is, if you showed up and actually provided some type of medical services and they choose to stay at home, have you picked up some kind of liability there, treating
Yeah.
the patient?
It depends on what kind of treatment we do. We have a set of protocols that basically says if we perform any interventions except for ABC, minor interventions, trauma dressings, the diabetic patient, those are very frequent. If anything outside of those 2 or 3 items that we do, it's a whole nother process. We're supposed to try everything we can to get them to go to the hospital. Because if we had to do something at home, they're sick enough that they needed help, so they should be evaluated. We do have a refusal form that if someone's very adamant that they don't want to go to the hospital, we call it a refusal form. It basically says, we were here, we helped you the best we could, you didn't want to go with us, if you die, you can't sue us.
It's just like a
It's probably not the
liability
exact
form.
verbiage of it, but that's essentially what it means.
It's a liability form.
See, the only thing is, so the ambulance service isn't used as a stopgap to go to the emergency room. If I can give you a call and you give me home service, that's okay.
Right.
Instead of me having to go to the hospital.
Believe it or not, people take advantage of the system all the time. So instead of calling maybe their neighbor that needs help up, or they need help up, but instead of calling their neighbor or family member, they say, oh, we'll call EMS, they'll come pick us up. And they do that, once, twice a week for 6 weeks. That's taking us a lot of time and effort, mileage. If it's here in town, not so much mileage, but we get some out in the county occasionally, then, we're not getting anything reimbursed for that. So that's why I think it's a $350 fee that the insurance is charged if we do get the evaluation only. Just to kind of try to keep people from taking advantage of the system. Yeah, we're gonna come and help you, but let's not take advantage of us. We're here for everybody, not just to come help you up every time you fall. Maybe call a neighbor, call family member, or somebody down the road, or, kind of a deterrent, I guess. It sounds bad when you say it like that, but it is what it is.
I hear regular calls sometimes from same address.
Yeah.
For that very
We
reason.
have a lot of we call them frequent flyers, people we see on a regular basis for various things. Some people call for the same thing repetitively. Sometimes they change it up, trying to throw us off a little bit. So it was the same complaints, same thing.
I personally think 2 trucks minimum at all times is the least that
It's
we need to
gotta
have.
be, it's
Yeah,
gotta be necessary.
I would like
The
to have
size of
3.
the county and
Work our way up to that eventually.
One of the things the council looked at earlier this year was to reduce some of the local income tax to this fund that would fund the ambulance service that it never occurred. And that was one of the driving forces behind it, because you are providing a countywide service.
Right.
And if we transferred that to that public safety, the entire county would pay for it. The way a lot of this is funded now is after the money is separated between the different units of government, and then the county is asked to take their smaller portion of it and subsidize the countywide service.
It actually would fund EMS services directly.
Yeah.
It wouldn't go to public, it would go to EMS services directly. That's what we were talking about doing at that time.
It was for that purpose. So the money was available.
Not right now,
And
it
it's a
can't.
service everybody uses and everybody should pay for. That's all.
Leonard, we can also discuss, since Randy wants to talk about the edit dollars, our auditor, Ms. Hammock here, had a budget presented to us, and we were in wonderful shape until we got slapped with the solid waste fees. And we had to budget solid waste. That's 270,000 that could have been put to EMS versus solid waste.
Out of our slice of the pie.
Just don't bring it up, we got to discuss it.
You know, there was a comment last budget session in 2023, Keith, that actually, I'm glad you reminded me of this. Because I was very much an advocate for properly funding the EMS. And I said it multiple times. I was ridiculed, criticized widely for it, but here we are. And you had said something in one of the meetings, I remember, that you had talked to Jared, and he said that you told us, the council, that Jared said the funding, what we had set aside would be fine. So what happened with that?
I would have to look back. I don't
I can
even know
probably get the
what
recording
year
for
or
you.
date, anything else you're talking about, and I'm sure Jared don't know exactly what
He
you're
wasn't
talking
there.
about.
It was your comment that you had talked
I
about.
wouldn't have said Jared said if Jared didn't, me and him didn't just have a discussion on
It
it.
was said.
It was said.
Well, when was?
I can get it for you.
I mean,
I think I have a snippet of it. I can send you.
first of the year, since you can bring up the edit dollars again and
We can't.
try to figure out how you can get Tell City's money.
I think EMS is, we need to figure this out. It's critical. It's not an option.
Jared, would you, if the commissioners, incoming council, didn't feel like the EMS was working out, would you have an issue of them bidding it out, getting AMR, yellow, if the hospital's interested in bidding?
No,
If, they think that they're getting such a raw deal.
AMR or somebody else can manage EMS better. Of course, we'd be okay with that. We do not want to give it up. I think it's very important for the county, that the hospital.
I think they will find it's gonna be much costlier,
Yeah. I
but that's what they need to find.
That's not our intent in any way, to give up management.
I didn't.
The building, right, I understand, Keith, I'm just, I think it would maybe provide some.
Open some eyes.
So where we at? We have a additional request for this appropriation.
Is there a way to do what Randy said and find out 24 hours the cost to run one truck fully staffed or two trucks fully staffed? If we had one, we could just double it, right?
Be a lot of things go in that. We're talking
Or get as close
cost
as
of
we
the
can.
truck, all the equipment to put on the truck, all the supplies,
Well, we
medication.
already paid for this. We're supposed to fund that, so, I mean, I guess the operating of it.
You want just like a salary overview?
Salary and the, whatever
We would
you're
have to
using
do like an
inside.
average of
I
what,
think you could put in how many hours our ambulances were in service by our operational costs.
I would like to have that, if you can.
spreadsheet you
Megan, can you get me that? Okay, thank you. I think it would be helpful, then we can see, help us.
And
For
that
budgeting
our ambulance
purposes.
is Probably another $500,000 years, whatever.
Till the wages go up, or whatever it is. What, speaking of the wages, you said they just went up in June again, is that right? June to July. So are we still comparable to surrounding counties? Because that's the goal, right? You don't want them leaving and jumping back and forth.
Yeah, I think so.
I was just curious.
We haven't lost anybody since he's taken over. I give him credit, I think he's a great leader. And
I take no credit for the pay raise.
People want to stay that our EMS commissioners are. My line, so we're not.
I know it was behind, significantly behind, and that was a big part of the problem, the critical pay and.
There's been probably, say, a handful of times we've had to pay critical insurance
That's
stuff.
gonna give you time
So,
to
A
advertise.
lot of us are,
Oh, yeah, part of it.
I don't, I would, I'm not on the truck too much all the time. I'm usually in the office, I do my 40 hours. Let everyone else kind of do their thing, but As far as having to pay to get people who want to come in, and not very often we have to do that. We're getting to the point where we're getting staff where we don't have to offer people pay all the time to get people who want to work.
So you're still doing that some, but not nearly as much.
Occasionally, you know, we get that Saturday night or something, someone calls in and it's like, oh crap, we gotta get coverage now.
Mhm.
Those oddball instances.
It was pretty routine there for a while, wasn't it? That's what I thought, but the conversations we had had before. So that's an improvement.
You know, there was a comment made a few minutes ago, if we could get somebody else to operate it. There's no way. I've worked with the hospital for 12 years now with EMS. Good conversations. They've always been there to work with us, totally. So that is not ever an option in my mind to find somebody else, because they are the experts with the medical field, with EMS, and they've always been there for us. And I know I probably might be the oldest one on here for 12 years. I've never had an issue. When we keep it local, that's just like our hospital. It's personal. You go up there, it just seems like it's a lot better than going and getting a number at somewhere else. And that's what you get if you get an outside firm to operate this. So I don't have much time left, but I know the council and the commissioners will figure this out. And I think it's kind of everybody's thought, I hope it is, that we can't drop below 2 trucks, 2 crews. Kelly said she'd like to see the 3rd crew. I'm with her on that. I know when we got 2.5, we were working for that 3rd one, we just couldn't get it. So, but thank you, the staff and everybody, for working with us for the last. So.
I can see the improvement just since I started in 2023 and going to the meetings and meeting with you guys, and talking to you about the issues, like you said. I can definitely see the improvements, and not only what you guys are doing, the pay, the staffing improvements, the equipment is getting better. We're starting to plan better for the equipment. We have plans to put back money now. I mean, it's going in the right direction. So.
And we were really fortunate with the ARP
Pretty happy
funds
with it.
also.
I need to have that.
Very
So far,
fortunate.
it's not-
They came in, it just seems like a godsend.
I had a question at the last meeting. We got the council here. A year and a half ago, when you come and submitted your budget, when the council, Kelly, was it 200 and some thousand appropriated for this year? Did you, I think you mentioned in the last commissioner meeting, your request at that time was around 400 and some?
485.
485.
I think 485 was for 2025. I think it was 435.
So if you look at that number, if it was 430, we could be real close to that, what they asked for, right, for this year?
No,
If we do
See, 'cause
the.
we paid it 285 plus another 120 just to get them
Three.
up to September.
Yeah.
No, 280, he's talking about this.
last year was, we requested like 430.
120 is where,
Don't need another
so we're
3
in
months.
405,000.
Yeah.
We have another 40.
So there'll be another 100,
The 130 would have been,
maybe.
So what I was getting at, if it was 430,
No, we
And if they-
increased the
how much
budget
difference
for
are they off?
2025 by 10,000.
100,000?
We don't know what they're gonna ask for the last
Yeah.
10 months,
Yeah.
but
To Randy's point, that's pretty
15,
close to
60.
our rate.
Okay, that's what I was getting at. I mean, you guys did your homework and said we need this to operate it for 2024. And we used to do that with health insurance years ago. Okay, we need this, but we appropriate this because it makes our budget work. Then when we needed money, the council always, and Stan was on there at that time, they found the money. I mean, it just seemed like the way it's worked. I know, Kelly, you did all the homework all the time. I know you know how everything worked on that, but it's just how it had to work that time, and that was the council doing that.
well, I
so.
think there were some costs that the county had, health insurance, like you said, some different things that were kind of robbing from that, so then they would have to come back and do additionals and things, so.
Mhm.
I prefer not to do that, I prefer a budget closer to what we realistically
Yeah.
need, and then,
In a perfect world, that would be right, but sometimes we're not in a perfect world. so.
one of the things we have to consider is equipment replacement. Because part of this money was always, we used to have 60,000 set aside for an ambulance or an ambulance lease or whatever that's for. Now we're using it for subsidy. We're getting there on the ambulances and we just have the equipment. But there'll come a time that it needs replaced again.
That's why they're putting the 100,000 back, because they said they needed $86,000, am I correct?
We did, yeah.
86,000,
Yeah.
yes,
You did.
in 2025.
We did, we set it aside.
I'm glad to hear that. Didn't know that.
It's a step in the right direction.
So the subsidy's the only problem.
So we were, just to step in here, so where we're at right now with this additional appropriation for 120,339.25, that will get them, that will pay for their P and L for August and September. We've got their P and L now for October, which is 26,335, which we would have to do, we'd have to do the steps of, if you did an additional on this. So you can only, in a sense, talk about this 120,000 right now, but just so you know, if at all possible, if this additional request for October for 26,335, along with your November P&L, in order to get that paid out in 2024, I would need that by November 4th, or December 4th. December 4th, sorry.
We don't even get our reports until
Yeah.
we see that same.
Yeah.
So
So your December would have, your November and December,
would.
you'd have to get them to me, huh?
You encumber them?
I'd have to have it to encumber
Well,
it.
that's true.
I have to have it to encumber it.
There's
So
no way you could
basically-
get it any
You'd have
sooner?
to, well, they'd have, what you could do is do an estimate. So like if you guys said, let's give them an addition, 50, let's do 50,000 or whatever. If they don't, and it only comes in for, 39,000, then you only spend that. You see what I'm saying? You could go ahead and plan and do an additional for October and November.
No, November, December.
No, October and November, because December you won't get till January. So that'll come out of January.
Or you just don't encumber it, and then in March you come back and get the
Could do
additional.
That's how
And
it
that
used to
cuts
work.
into your 2025 budget.
Yeah, we'd come
So
back
if
in
you go
March.
ahead and do an additional for October and November, a guesstimate, and just say, okay, I'm gonna give you $50,000, and they don't spend all of it, then you're not out it. Do you understand? Because if you don't spend it, it just stays there. So I wouldn't wait, because you're gonna be off on your funding again in 2025, where you're paying for 2024 out of 25 if we don't get it. Because typically you're paying December through November in a year's time, December through November in each year.
And then additional appropriations don't open back up till March.
Correct. But you'll have your new funding for
Yeah.
2025. You
It'll just
shouldn't have to do any.
make it short.
We don't want to do this tonight, though.
Why not? You're both here to approve it.
That's true.
Council first, or commissioners first.
You can vote yes. Commissioners have to approve it first, then you guys.
Do we want to go ahead and do this then, the 120?
You know where you're gonna get the money? I mean, I think
I'd say
that's
it's going to come out by county general. I don't know where else it comes.
riverboat.
Riverboat.
That's the go-to for everything.
I don't think there's that much in there.
I think it's 170 or something. I could look.
There's other stuff to be coming out of that.
What do you have coming out of it?
I don't know. I'll have to get back to you on that.
This is already gonna happen. Was this advertised?
No, it has to go to you first. Oh, that can't even go, you
Yeah, we
guys can't
can't
approve it
approve it.
yet. You guys will have to wait for that one, because it has to be approved by the commissioners first, then it has to come to you. And
Why can't they approve it?
they can approve it,
Yeah,
but
but
you
you have to
can't.
advertise.
Yeah, so it'll be in December.
We can
Chris, what was the last day in December?
Okay.
What was the last day in
Last
December?
meeting.
Yeah.
You said
I have to have it to the advertised December 4th.
Oh, 4th, okay.
When you find it,
They would get it.
you need to
Get in time, yeah.
October and
Yeah, I can go ahead and do October with it, yeah.
probably the Esther too.
Yeah.
You'd have to-
So you guys can increase this amount, the commissioners, because this isn't an advertised amount. So you guys can decide today, August, September, add October, and then do an estimate for November for the additional, because this is just a department approval. Advertised can't be raised, so then that'll tell me the amount to raise to take to the council at their December 19th meeting.
So that don't have to be advertised, right?
It will have to be
It will,
advertised,
for the
but it'll
council.
go to the December
Yeah.
meeting.
For the council. For the commissioners, not.
Because you're just asking us and then.
Yeah.
have it
Yeah.
say,
So I guess the next step is for the commissioners to decide how much they're going to
10
take
days,
to the
so
council.
Thursday. So
Yeah.
it'd be the 10th. Well, we can have a special.
It'd be December 19th.
You guys have it before December 4th.
So if you take
Additional appropriations.
120, 339.25 plus 26,335. So to get them through, October, it'd be 146,674.25. So then
If you want to add for November,
another 30.
20.
40.
Hey,
Okay, it's not a bidding war.
are we having an auction here?
I think we averaged about 40,000.
What'd you say, hon?
I think we averaged about 40,000 a month, if I remember right.
Oh, well, you can,
My
you got really
average is
quick.
43,890.
Wow.
40.
So maybe add 40.
Well, hopefully it'll be a low month. Maybe it'll be another surprise month with a positive
Like
number,
May, yeah.
like May.
Isn't there a lot of 26,000?
I mean, we could hope.
It seems like 26,000.
So that'd be for, add another 40,
186,
186,
674.
674, so I'll round that up to 190 just to be safe, for the 130, whatever you want to do.
Wait a minute, we was at
10 business days.
176, we had 40.
Who's at 146?
146 plus 40.
46.
So if you think about that, then here, let's just throw another figures in there.
Just to know.
So that'd be, what did I say? We've done, what did I say? 186, let's just make it 190 to be easy, plus
We
275.
can advertise it tomorrow.
465, and then we moved over 31,000 from equipment to there. Honestly, I can't add on my calculator. That'd be, what is
You're
it?
at 500.
What is it? What did I say? No, I lost my numbers.
David, what's in equipment?
Huh?
What's in equipment left?
Nothing, they transferred
Oh, I
all
It
of
was
it.
a transfer.
Okay. I thought you were saying there's some left.
We had paid, so we paid out the full that's what I was doing, we paid out the full 275,000 plus 31,000 that we transferred, so that's 306 that we've paid out total. If you do another additional, so plus 186,000,
42,000 a month. It's only gonna drop.
that puts you at 492, pretty daggone close to what
No,
they
net
asked
income
for,
is
the
showing it
485. So,
net loss.
it's not you, it's the commissioners,
Commissioners need to do it.
like 190.
Chris, you said
Are you guys gonna?
rounded up to 190, is that what you said?
I think we can look what we got.
Say,
He acts like he wants to wait.
Should we do it this meeting or next
We have
meeting?
a regular meeting.
I mean, a following meeting.
Can
Can we do it in this meeting or do we do it?
Then the council
6
has
o'clock.
to take care
we
of
can
it.
do it now.
Council take care of it.
It's been
Yeah,
advertised.
yeah, but we gotta do our part first.
Because it has to be advertised for them. So if you round that up to 190, that's gonna take 4,000 more off. Well,
See what Randy's doing down there. One of us will have to make a motion.
Motion adjourned.
No.
Four ninety-six instead of 492. And the budget was asking for 485.
430. 485 for next year. 430 this year. That's what Kelly said.
We could
So,
get
what's the
them to stable and bad debt.
11,000. That's, yeah, I mean, for 190. This year. If you do that, it'll
You
be,
guys on the council are the ones.
No, it's you first.
No, no, please, Chris. You need to determine
Yeah,
funding.
yeah, yeah.
You know, all we would do is approve it, but you guys need to, I think, look at where you're at, what kind of accounts have money in them. And maybe you want to do some splitting, take some out of one account, some out of another, or however you want to get there. But I think you need to take a look at where your balances are. That's your money issue, that's not the commissioner's issue.
Yeah, but we gotta go ahead and prove the 190.
I mean, we can,
yeah,
Yeah.
we can approve it without having a funding number on it. And then they can go take a look at where their funds actually are, and maybe they want to drag it out of 3 different accounts or something. I don't know where your balances are. But that'd be something for the council to determine.
if you round that to 190, that'll come up 11,000.
Are you ready for a motion, Randy?
I mean, you guys, I mean, I want to, if we approve it, I'd want to do it subject to the council making the determination
Where the money's
where funding
funded.
sources are available. I mean, that would be their call.
That's all we can do.
So that'd be your motion.
Randy wants to make the motion.
I'll make that motion then.
I'll second it.
For 190?
Yes, and let the
How much
council,
more? They got 120 they want, and another 26 roughly for October. And then they're going to turn around and we'll have one more bill in this billing cycle, the 24. So
It's like 186 and some change, 187, so
We're gonna be
190 would
about-
give you 3,000.
what, 166, something like that, if it's the same as
I just
October.
added it, darling.
Well,
I thought it added up to 186.
They said to add 40 on for,
They took the average of 12 of the year, or what is,
I didn't.
Whatever money we
Yeah.
don't spend will come back.
is 186.
186, 674.25, so I said round it up to 190.
I say leave it at 186.
186.
Yeah.
I don't think you're gonna spend that money because you won't have your bills,
We can encumber.
if you get a bill.
Well, we can just,
Only if you get a bill.
let's do it with 186.
They typically, when will you have your November bill done?
You just gave us the bill today, right?
For October?
Today's 19th,
And it's almost
Had it
in.
done yesterday.
so.
Yeah.
I mean, I can get it quicker than that if,
Yeah,
we have to, we're dependent on other departments too, like materials and supplies and things like that, but if we can get all that information, 5-6 business days, maybe a week. So, I don't know.
I mean, Taylor, you and I have talked about that, you understand how it falls. So if we don't have it, yeah. The last claim docket, scheduled claim docket is December 17th.
And the next council meeting's the 19th.
Right.
Guess they have a special one.
And we'll probably end up having to have a special commissioners to pay out last bills, so.
Commissioner.
Oh, we always have a special
November,
commission meeting in December. To clean
Yeah,
everything
she
up.
won't get it.
She won't have it by then. She has October by
She'll have
November.
November by then.
And November, December.
Advertise it for additional, that's why we have to go ahead and figure in whatever it is. As long as she has it to me, and we don't have to do an additional, I can get it paid out on the 17th because the money's already gonna be appropriated.
If we appropriate it, you guys figure we want to get a little bit here or there, just like Randy said, right?
I know, but if she has to advertise an additional, she has to put where it's from, right?
The additional won't be advertised. I mean, we're well past November. So all this additional, even this 120, everything will be advertised on December 7th or December, whatever that Monday is. I have to have it. I just looked it up. I have to have it advertised by, I have to have it to them by the 4th. It'll be advertised on the 9th for the 19th meeting. So the Monday, the week before your meeting there. Next year, we won't have to worry about this. Well, it has to be advertised 10 days before, no matter what. So I have to advertise the 9th.
You just don't have to put it in the paper.
And so if you guys go ahead and do the additional, or I know what to advertise, then this will all be advertised on the 9th for you guys to be approved on the 19th. We will have to do a special meeting with the commissioners at some point to pay out end of the year claims, because the last claim docket is on the 17th. Last scheduled claim docket is on December 17th. So, yeah.
That's the latest you can do, right?
Oh,
17.
yeah.
I mean, you guys can get your numbers where your balances are, have a special meeting, determine where you want to get the money out of,
And we can do it.
advertise it 10 days later, and have one of these noon meetings that last 5 or 10 minutes.
Yeah, we don't have to wait till the
You don't have to
19th.
wait till then, go ahead and get it done.
But you're just gonna have to guesstimate on November. No matter what.
And you said like 40,000.
So Randy, we still looking at 186 then?
186,
Okay, so,
contingent upon the council determining the funding sources.
okay. I think you got a motion and a second on the floor here.
Any further discussion? We don't really have a meeting here, but
What's the amount? It's an advertised meeting.
oh,
I didn't know what you're saying.
it's not on the agenda, I'm not sure. All those in favor?
Aye.
3 ayes, so it's up to you guys now to
What was the amount?
see where you.
186.
I'll go pull fund balance.
So-
Can you send that to us?
Would you
You
want,
got the
That's all right,
balances and then send them out to everybody.
Yep.
So they can look at them and then have a meeting sometime when it's convenient for everybody.
And you're right, it can come from different areas, so.
Mhm.
I like to look at
Probably
that.
gonna have to, yeah.
I like to
We'll have to see what's available.
Let's get creative.
anything else? If not,
Thank you.
Motion.
motion to adjourn by Keith, second by Paul. All in favor of adjourning council meeting, signify by saying aye. Motion carries 6-0. We need to adjourn your meeting, Commissioner.
Oh, Dr. Poppy. No, no.
We got a 30-minute break now. I'm gonna grab my phone, I'll let you in the truck.
All right. Okay.
No, it's not.
Well, I got settlement tomorrow.
Good job. Okay, these are things that we have to do. No, this isn't like, can we, can we,
It must be your phone.
Oh,
Make sure those are funded, then we fill in, then we fill in the other, what else do I have left?
And you sign this.
I mean,
That's,
if you're not.
I heard that's not fun. It's not, it's not fun, it's not popular.
That's right, that's what I was trying to say. It's life.
It is, that's what you do at your house, you pay your bills, you go buy a Corvette, and say, well, I can't eat. Okay?
We'll pay utilities before we go out and eat.
Yeah, no more tractors until you pay your house.
Hey, wait a minute.
I guess that can run.
That's the balances. Thursday's meeting.
I can get that to you.
That way.
I don't care. That doesn't bother me.
Sure will.
We're not catching anything.
I was told not to until everybody left.
When we adjourn, it's not. When you adjourn, it should go off. I don't care who told you. Who told you?
Luke Britt told me.
Who?
Luke Britt
Who's Luke Britt?
with the open door access. He said, I stay here till everybody leaves if there's meetings going on.
Well, when it's adjourned, you turn it off.
Okay.